Often when I talk to people about natural running, we point to like the Tarahumara Indians in Mexico or indigenous tribes in Africa, where they grow up running barefoot and then they continue running either barefoot or in super thin shoes. And they're very successful runners. And people sometimes respond, yeah, but they grew up that way. I can't do that. Is that true? Maybe. I don't know. We're going to take a look on today's episode of the Movement, the podcast for people who want to know the truth about what it takes to have a happy, healthy, strong body. Starting feet first, usually, because, those things are your foundation, but there are other parts that are important too. We also break down the propaganda, the mythology, sometimes the outright lies you've been told about what it takes to walk or run or hike or play or dance or do yoga or CrossFit or lift or anything you can think of, and to do that enjoyably, efficiently, effectively. Did I mention enjoyably? I know I did. That's a trick question. Because the whole point is, look, if you're not having fun, do something different so you are. Life is way too short. And by the way, we call this the movement because we're creating a movement that involves you, and I'll explain more in a second, about natural movement, letting your body do what it's supposed to do. The part that's about you is really simple. You're spreading the word. So the way you spread the word, come check out our website, www.jointhemovementmovement.com. There's no cost to join, but you can sign up to find out when we have new episodes or anything special going on. You can find all the different places that this podcast shows up, including YouTube and Facebook and Instagram and all things like that. And you can, of course, give us a thumbs up and like and share and subscribe and all those things you know how to do. In short, if you want to be part of the tribe, just subscribe. So let's jump in. Jerry, it is a pleasure to have you here. It's my favorite thing to do right now is not introduce you, but let you do that so you can tell people who you are and what you do.
Yeah. Well, Steve, I want to thank you so much for letting me be a guest on your show. It's an honor to be among many other rock stars in their respective fields. So thank you. For me, I've been in practice for about 20 years as a physio. I have a practice in Woodcliff Lake, New Jersey. And we specialize in treating active people, men and women over 40, and their families to stay active and fit without medications, injections, or surgery. So we see CrossFitters, we see runners, we see triathletes, people who are really into just fitness itself.
So what's your background? What got you here?
Oh, so basically when I was younger, I had wanted to help people, of course, and I had a desire to be in the healthcare field. And I found that physical therapy was a way to blend your science, your biomechanics with helping people to avoid surgery and stay active. And through the years, as I've gotten older, I've been focusing more on the people over 40 because I'm kind of walking along with them as I'm also in my 40s. And hey, what better to have a coach who's also knowing what you're going through, getting up and being stiff and needing more time to warm up. And it's been a great journey for me to get here. Yeah, so.
The funny thing that I notice about what's changed as I've gotten older, in addition to taking more time to warm up, is as a sprinter, it takes me more time to slow down. So at the end of something, I just like really stretch it out and don't slow down like in 2 steps. I'll just keep going, which makes me want to build a track that has a giant gymnastics foam pit at the end, so you can just jump right in, which would be fun.
Yeah, I hear you saying, yeah.
So talk to me, look, we have a lot of physiotherapists and physical therapists, depending on which side of the ocean they're on,
exactly,
who want to be on this podcast, who are not on this podcast because they're fundamentally not doing anything different than anybody else. And when you reached out and when we reached back out, or however the hell the reaching happened, it was clear that that was not the case here. So talk to me about what you're doing that distinguishes you and what you do with human beings from the average physical therapist that somebody might bump into.
Yeah, thanks for asking. So I'm going to talk about a top-level approach or sort of view of our clinic and our practice. We have amazing staff everywhere from our business manager and our operations staff all the way to our clinical team. Everybody just has a really good team approach to how they want to have every patient and client come in, experience that environment of sort of a family feel, a community feel. And as you and I know both, that when you feel like you're cared for, when you feel that somebody really has your best interest in mind, you're going to have a much better hope of getting better. And so that's been instilled in my team from day one. So it's all about, let's have the best patient experience, best client experience for everybody coming in. They know they're cared for. They know they're getting expert help. A lot of people, when they give us testimonials, are like, hey, you guys, not only are you professional and you know what you're doing, but you guys also provide that community feel. I feel like I'm going to get better by being here. So on that top level, that's what we do. Now, if you look at our clinical team, everyone is very active. By the way,
I'm so glad you're heading there because I was going, yeah, enough of that touchy-feely crap. Let's get into the
yeah. So with our clinical team, everyone is very active. So all of us are either former athletes, like Dr. John is a former Division I swimmer. Dr. Dave was a wrestler and is really into treating Division I athletes and high performance athletes. Alex was also a former gymnast. Pam was a high level soccer player. So everybody in our clinical team just really gets it. And as far as our approach goes, it's really about, let's just break it down for you. And we want to get you back to what you want to be. So if your goal is I want to get back into running, I want to get back to my CrossFit. Okay, so here we are today. This is our phase 1 of our MEI method, which is Move, Excel, Inspire. And we're going to get you so that we can calm that pain down and get your brain to sort of calm down that pain as well. Then we're going to move you into the things that you want to do, but we're going to be very careful about loading it. So it's about sort of like that load and expose, but in a very intelligent dosage, if you will. Because you know what happens when people start feeling better, what do?
They test
right back. Yeah. From there, we get to our Aspire phase, where it's about helping people to say, okay, listen, now let's get you back into your running, into your lifting. But instead, what we're going to do is be very careful again about dosing it correctly. So, because we want you to get back to what it is 100% for sure, but it's going to take us some time, especially for us over 30 and 40. We're going to have to get there a little bit more gradually and intelligently.
So there's 2 questions that pop into my mind about that. One is, and I don't know which one I want to do first, so I'm going to spit them both out and you can decide what to do. And we might do one and then forget about the other. Who the hell knows? Yeah. So the first question is, for people who are listening, if you can think about like the most common problem somebody might come in with, and one of the things that you might be able to recommend, I'm trying to think of how to ask this, that people who are listening or watching could do, but I want to highlight how it's different than what other people might do. In other words, if you're having people start somewhere slightly differently than what they might be thinking they should do, that would be really cool. But the other part is simply the age thing, is that what are you doing differently with people because of the age compared to earlier? And this goes back to what I teased the opening with, of, are you too old to learn? Can you really make these significant changes in movement patterns and gait patterns, et cetera, at any age? And if so, how does one do that?
Yeah. So I'll answer the second question first. And I would say that, first of all, everyone has a high capacity to change no matter how old you are, for sure. It just takes us longer to get there. And I think a lot of it has to do with coaching them correctly on the mental game too, Steve, where it's like, listen, I know you want to get here. We have these things we have to deal with. These are your impairments. These are your mobility restrictions. These are your strength deficits. Let's work on these basic fundamentals that are related to whether it's running, CrossFit, what have you, and carefully, again, dose it correctly so that when you get back to what you want to do, you are going to go to that level very strong and very confidently.
Well, I'm going to shorten that to, it sounds like the change in the mental game is dealing with the fact that those of us who are getting older, our brains think we're one age and our body thinks we're another.
Absolutely, yes, exactly. That's exactly what it is. And, that's actually puts a lot of people into injury, right, Steve? It's like, well, when I was in my 20s, I could do this. And they still think that in their 20s. And that's when that friction between what your body's going through right now and where your body was back then have that conflict. And sometimes things just don't go right.
Yeah, not so much. It took me a long time to learn that when I used to train in my 20s and into my 30s, if I had the thought, let me just do one more set, rep, whatever it is, totally fine. And now when I think, let me do one more, that's my cue to stop.
I'm exactly in the same boat as you were. When I start feeling a little bit of something, I'm like, you know what? It's not worth that rep. Let's just take a step back and scale it back. But I think it's that voice of reason that sometimes our older athletes need to hear. And listen, it's great that you ran 5 today. And it's great that you were able to have the sense not to run that 6 because that's where our threshold was. Mm-hmm. So it's about having them change their game too and adapting to where they might be in life to accommodate that.
Got it. So if you can say anything more specific about just that transition for, into new movement patterns, new strength or whatever for older athletes, or not even athletes, just for older humans, what do you do or what would you say about that?
So depending on where that person might be. So let's just take a runner, for example. If they're looking to transition into a minimalist shoe or into running forefoot strike, it's really about, hey, listen, let's just start with some static stuff. And this might even apply to a lifter who wants to lift heavy weights. Let's just start with with a body squat, get your body to adapt to that particular weight or load. And from there, let's carefully now meter out what needs to be done for the next step. So it's like taking the movement they want to do, breaking it down to body weight calisthenics first, having their form be perfect in that position or technique. And then from there, start loading it as we go. Whereas if you go to some places, they might just say, well, let's just, give you pink bands or pink weights to do. And that's your rehab experience. And a lot of us have gone through that. They're not really loading correctly. They're not loading enough. And I've met a lot of physios who are afraid to load because, well, I don't know if they can handle, benching 200, but that's kind of their goal. So you have to really match up with what they're trying to do. So I think that's where understanding what the athlete's mindset is and where they want to go, I think makes us different, where we're trying to really push them into those, even into those painful areas. Like, listen, if this is where your threshold was, I want you to get it past that. So we're going to have to really kind of increase the intensity. And that's where I think a lot of physios need to really take that into consideration, whether or not.
So if we're going to use the example that you gave, which is one that is obviously near and dear to my heart, about natural running, whether it's barefoot or minimalist, which will involve landing midfoot or forefoot, typically forefoot. So the first thing you talked about is just doing bodyweight squats. Can you talk about other things that you're doing with people to get them used to or acclimated to the kind of loading? I mean, basically, I'm looking for, from your perspective, what a sequence is from someone walking in the door to when you and they feel confident that they can kick off their shoes, for example, and go out and run. I'm not going to say, run a half marathon or a marathon, just, to be able to get out on a road and run comfortably in that condition.
Sure. So when they come in, and first of all, if we're looking at somebody to transition to minimalist shoe, obviously, the first thing I'll say is, listen, well, you got to see where you're at right now first. And we'll kind of go through our evaluation.
What are you looking for or at when you do that?
So we're looking at prior history, prior injuries. If you had, so for existing Achilles tear, we might be a little bit more ginger about how long it's going to take for you to transition into running more minimalist.
Got it. Basically, just getting a baseline for where someone is.
Baseline, exactly. That's exactly where we are. And from there, now we work on like, hey, listen, you're used to wearing these shoes that are restrictive. Obviously, shoes like Zero, for example, other minimalist shoes are going to give you that sort of like working your feet out because you haven't been using the feet and the toes, all the intrinsic muscles that help to govern movement in the foot. So let's have you start walking around the house barefoot. Let's have you start walking in minimalist shoes. I know you had Irene Davis on your show a while back.
Yep.
And she was saying how even if you are walking in minimalist shoes, you are training the muscles of your feet to be able to adapt to the change that you need to go. So even just walking around the house, having it maybe throughout the day is like, well, I notice that my feet get tired as I'm trying to wear these minimalist shoes. Okay, well, let's just say 2 hours on, 2 hours off. Let's just start gradually going into that. And that should be like a phase one kind of ordeal. Standing on one foot, very easy kinds of activities where you're feeling the ground. From there, you can progress into, say, standing on a foam mat to where you're swinging your leg all around on one foot so that your feet are, again, you're really training those muscles in the foot to be able to adapt to the change that needs to occur later on. From there, we're going to start adding in drills dynamically, whether it's stationary running drills. So just by running in place, as you know, Steve, as a coach, you're going to be landing forefoot as it is. So people are like, oh, I didn't know it was just this easy to really kind of think about. And from that concept, we start adding in like the fall forward. So having them understand that, listen, you can get free speed by letting gravity help you. And so they get that feeling, the brain starts to connect to their feet and to the demands that are required. And from there, we start adding in distance. So it's like, okay, listen, on your run today, I want you to go run for a minute and then walk. And really be aware of how you feel. Because by this time, they've been wearing the minimal shoes. So they're adapting. Their Achilles, their calves have really adapted to that demands of running that way. So as they go into that stage, we then start adding distance over time. And I'd say the process as a whole, Steve, really takes about, I would say from your experience, maybe 3 to 4 months of safely being able to transition someone into that area as a minimalist.
I mean, I think Irene's point is, if you're just going to start walking, if your feet get tired, give yourself some rest. But there's really very little to no transition time required for walking. But if you're going to do something more high performance, whether it's running or lifting, then there is going to be a different transition period because you are getting used to that. So what you just did actually is, in a way, answering that first question that I totally forgot from 5 minutes ago. So, which is good because I totally forgot it. But, are there any other things that you can think of that when people come in, they have certain ideas about what the process will be like to learn some new way of moving that's going to be healthier, et cetera, that you have to rid them of in some way?
Oh, sure. So for example, we have people who want to learn how to squat properly. So they'll come in and we'll evaluate their squat. Again, look at their history, get that baseline of their movement. And from there, we'll say, okay, let's see what that looks like. We'll film them and videotape them to have them see the feedback right away. It's like, this is what you look like. And then we'll say, this is what I want you to look like. And we'll demonstrate the movement ourselves so they can get that sort of visual cue. We'll have them retest over and over again over repetitions and then show them, okay, now you've improved. This is what you need to work on now. So just to fine tune the movements. And then from there, it's okay, let's add a kettlebell. How does that feel in your feet? Where do you feel weight distribution? And start working through that. Okay, now let's add in the barbell. How does that feel on your back? How does it feel if you're doing a front squat on your shoulders and the mobility that you need to get there? And from there, we start building them up. And, for them, they're often like, well, I didn't realize it was going to take this long to understand this movement. Well, it's like everyone wants to like instant fix, instant sort of results. And that's where we're trying to, I guess, change our mind, saying, listen, it's going to take you a little bit longer than you think, but you're getting there. Here's a progress that we see objectively.
It's interesting. I love that you're videotaping people. One of the things that I've noticed is many people, most of us, I would argue all of us at a certain level, have a mismatch between what we think we're doing and what we're actually doing. Our proprioceptive skills are not what we think they are. And even if we have good proprioceptive skills, there's going to be subtle things. The better you get, the more subtle the things are where what you're doing and what you think you're doing are out of line. I got videotaped last week. Do you know Nicholas Romanoff, the guy who came up with the pose method?
Yes, of course.
So Nick was here, he and his son Severin came and spent a couple of days here, and they said, let's go out and videotape you. And so I was like, awesome. I can't wait for you to find out what's wrong. And so, because I know there's going to be something that I can improve. Yeah. And what they identified was something that's super, super subtle. Again, I mean, I'm a master's All-American sprinter. I'm pretty good at what I do. But what they found was something that I would have never known if I hadn't seen it on video. And that's the only way that I'm going to be able to correct it is by continuing, or at least for now, is by continuing to get that feedback about because now I know what I need to do. I didn't need to see someone doing it perfectly, although we did watch slow-mo video of Usain Bolt. But believe it or not, I am no Usain Bolt. I don't know if you noticed, but I'm a short white Jew and not a tall black Jamaican. Not that Jew and Jamaican are any way, get the point. So I don't eat yams. Let's say that. I don't like yams. Anyway, it was very helpful. Because, him saying, here's what you need to do and here's what you're doing. I didn't need to see a video of someone doing what I needed to do because I could tell that one. Yeah. So that's super, super helpful. And the slowing people down is also helpful because what people don't realize is that the only way you adopt a new movement pattern is by doing it slowly, correctly. And once you can do it correctly, then you can pick up the speed a little bit, and then you're going to get it wrong every now and then you back it up until eventually, the speed and accuracy improve until you can't do it wrong. And I just remembered I had one sprinting coach who said that to me when we were learning a new way of doing sprinting drills. He said, at first, you're going to try to figure out how to do it right. You need to get to the point where you can't do it wrong.
Exactly. That's true. And it's funny because you've done the 2D analysis. We're now doing 3D analysis for gait. And if you ever want to come by, check it out. It's amazing. So in real time, you're seeing, minus the clothes and minus your muscles, you're seeing real time footage of yourself running in space. So you can actually autocorrect in real time, watching yourself on the screen, which is wild.
Well, that's, the whole thing of instant feedback is super, super important. It's something, there you go. Now you're back. It's something that Irene Davis does in her lab where there's, like you said, there's strengthening and exercise she's doing in advance. But then for some of the gait retraining is you need that real-time feedback. I mean, ideally, you don't need it, but it certainly helps. One of the things that she does, I don't think we talked about it on her podcast, so I'll tell you now, and I don't know if you've ever done this. She'll have people run on a treadmill and there's a mirror in front of the treadmill. And she has a drape that she can drop over the mirror so you can see yourself or not see yourself. Yeah. And mostly she's using this for people where if they're running, their knees are coming inwards. They have vastus valgus. Yeah. And that's usually because their glute isn't firing properly to externally rotate their femur to get their knees pointing straight. So what she does, she comes and she pokes them in the butt and says, tense that up so I can't poke in as far. And then they're going, and often for people for the first time, they're going, oh, that's my glutes. They had no idea. And that'll straighten out their knees. Or she'll just say, straighten out your knees. And now I want you to run and look in the mirror and keep your knees straight. Yeah. And just get used to doing that. And then what she'll do is like put the drape down so they can't see themselves for 30 seconds at a time. So they have to internalize that process.
Yeah. So it's intermittent sort of feedback, which is great to learn. Yeah. We also have a mirror in our clinic where we have people run towards the mirror to see themselves. And they can also see if they do have a collapsing sort of valgus, they'll see that, oh, I didn't realize my knees actually collapsed that bad. Right. Yeah, now let's try to work on that. Yeah.
It's amazing that people don't avail themselves of getting that kind of video feedback. And man, I was driving down the street the other day and I saw a woman running, clearly an accomplished runner. I mean, there was so much about her that was right on point, except for the fact that her knees were like banging into each other with every stride and her feet were, like pointing out. I mean, it looked like clown running in a way. And I'm thinking, if you haven't been injured, you're about to. And that's something, again, that's one that's relatively straightforward to correct. It just does take time. And as you were saying earlier, the older we get, it doesn't stop us from doing it. It just takes a little more time because our brain just isn't as neuroplastic as it used to be.
Exactly. Yeah. And, it's funny thing that we've been getting on the topic of correcting form, how much of strength training can really help you get those muscles to fire the right way. And just by bringing the awareness of your brain to those areas to start working right, because you haven't been using them right, just like we talked about the feet, needing time to adapt to using those intrinsics again. So, for example, we have runners who are like, well, I've been running my whole life and whatnot, and I've been dealing with this knee issue. Well, let's take a look at your movement. And when we see that collapse, obviously we're going to test out the glute medius. And when we test out, well, this is pretty weak. So, no wonder you're collapsing. No wonder you have the IT band issue that you've been dealing with for years and years.
Right.
We start looking at those components. And for them, they start becoming believers when they see the result of working on those areas. And again, it's coaching them and convincing them that, yes, running is important. It's great. I want you to do that forever. But let's work on these couple of things to make you even better at running.
So there's a lot of, let's call it conversation for the sake of being polite, which is odd because I never do that. But what the hell? We're taping this on a Friday. I'm in a crazy mood. I'm being polite. Yeah. So let's say politely, there are conversations about lifting and running, or strength and running, or strength training and running. What thoughts do you have about that? Or what have you discovered that is either things people need to know or things people need to unknow?
Oh, it's funny. First of all, there's still this friction with some runners and with lifting, saying, well, and it happens to be a lot of our female clients will say, well, I don't want to put on that bulk.
I don't want to get big. Right.
I'm going to tell you this. You're probably not going to put on the kind of bulk that you think for many different reasons.
You can take the word probably out of that.
Exactly. You're not going to, exactly. And then from there, it's like, well, I don't know how this is going to help my running. But, well, if you are stronger, if your glutes, for example, and your hamstrings, because a lot of runners don't access those muscles, and your core muscles you're using as well, if they're in better shape, you're going to be able to run longer, first of all, and your ability to dampen the forces on your body and your joints is going to be that much better, and it's that much more necessary as you and I get older. And obviously, as we get older too, there's sort of sarcopenia, where we're decreasing muscle mass as we get older as it is. So you want to maintain what you have on your skeleton, so that when you are running, when you're doing things in life, you will have the power to be able to get through and perform like you want to perform.
Am I the only person who thinks the word sarcopenia should refer to something else that's kind of perverted? Is it just me? Just saying. So I just had a thought from what you said that I don't know if it's true or not, but I found it interesting when it popped into my brain. And that is, it's maybe one of the advantages of strength training is not even necessarily that you're getting stronger, because especially if you're a distance runner, you can't just keep applying force all day, every day. My hunch is that what's going on from strength training has to do with as much about awareness as anything else. So you're becoming aware of certain muscles, certain muscle groups, certain patterns that you weren't aware of before, aware of in the same way. And that as you're running, that awareness will translate into different kinds of movement, because now you have information at your disposal that you didn't have previously.
Absolutely, yeah. And it's funny you say that, because let's take the example of the genu valgum, where people collapse at the knees. If I'm having you do lunges with weight and load, and you're watching yourself in the mirror, and you're seeing, and you're able to control your knee in a much better position, you're going to see the result of that. And that's going to translate into activities that you're doing with running as well, for sure. And you're also strengthening those muscles too.
Well, because, I'm thinking about the whole idea of getting stronger. I did something the other day as part of a workout where it was doing single leg calf raises. And basically as many as I could do in 5 minutes. And so I would do a set till I, couldn't do another rep, switch feet and repeat. I ended up doing 72 per foot.
It's impressive.
And that was 2 days ago, and I think I'll be able to walk by tomorrow. Now, I have no problem running where I'm applying, where I'm doing way more than 72 strides per foot. I'm doing many, many, many times that. So clearly, getting a little bit stronger is not going to be the thing that changes my running. And I don't know that I need more awareness about my calves, but that's partly what made me think about the whole awareness component rather than just the getting stronger. Because if it's just about getting stronger, then some giant Olympic lifter should be faster, but they're not.
That's absolutely true. Yeah. And I would say that I would agree with you I would say the awareness supersedes the strength, especially in runners, because they're doing this repetitively. But for sure, the strengthening will benefit for them, the awareness part, and also for their running itself.
Well, and also, it's a different thing. Like I think about distance runners versus sprinters and this applying force idea over time. One of my best friends is a world champion cross country runner. He can do like a 200-meter run and then rest for 30 seconds and then do another 200 meters and rest for 30 seconds. He can do that all day long. He never gets any faster or slower for that matter. But, conversely, I can do 2 of those at full speed. I mean, his full speed, he can just keep doing it over and over and over.
Right.
But his full speed is significantly slower than mine. And, and I can only do a couple of them until I'm done for the day. And so there is that difference in how your body processes energy and creates energy that is different for people who are fast twitch people, sprinter, powerlifter people versus slower twitch, longer distance people.
Yeah, absolutely. I know that a lot of our strength coaches and our physios that we work with also say that on top of the awareness benefits from lifting heavy for long distance runners, you also get that hormonal input from growth hormone, from testosterone that gets secreted when you lift heavily. So even for our triathletes, and we've seen big performance changes in our athletes where once a week in season, they'll lift heavy, they'll deadlift, they'll squat heavy. And those recovery days, they feel, I feel like I can run stronger now. I can swim faster, whatever it's going to be. So they're getting this great input from the brain and from the hormones to be able to recover faster as well.
Allison Felix's coach, and Allison, for people who don't know, is one of the most successful sprinters in history. Before she set a personal best in the 200 meters, the day before she set a personal best deadlifting.
Wow. There you go.
Yeah.
That says a lot.
And I want to highlight that point because most people, when they think about lifting, don't think about how to train for maximum strength, how to lift heavy. Can you give people any comments about that or any suggestions about how to do that in a way that's that will not terrify them? Because I know, look, big numbers are scary. I remember the first time I deadlifted 300, it was like, whoa, that was crazy. And the first time I deadlifted 400, it took me a while to psych up. And then I did it. And then, of course, my next thought was, crap, now I got to go for 500. Luckily, I'm smart enough to not do that. But, as you start adding those numbers, some of them are psychological barriers, just like
they are.
Birthdays that end in 0 or psychological numbers. But talk about what it takes to train safely for lifting heavy.
Yeah, so I think the first thing is making sure that if you don't know the movement itself, Steve, you definitely got to get a coach to help you out, or a physio is trained in doing that. Starting off with the basic movement patterns and making sure that you have the right amount of movement to be able to even do these motions. So, for example, if you had a back issue and you want to do deadlifts, let's make sure that that's not going to become a problem as you increase that load. Yeah, that's sort of parts. From there, I think a gradual increase over time where you're increasing the load, you're decreasing the reps and sets and testing things out as you go along. If we're looking at strength, we're looking at anywhere from 4 to 6 sets for about, say, 4 to 8 repetitions. And so being careful about how you dose it over time will definitely help you to do it safely.
Yeah, both of those are really good points. And making adjustments if you do have something. I mean, I have a compromised spine. And as much as I love to pull heavy and squat heavy, I have, with great reluctance, stopped doing that. And so I'm doing other things instead, sometimes just single leg stuff. So I can use half the weight. Actually, crazy. If it's single leg, it's not half the weight. It's usually like 3/4 of the weight, which is very weird. I'm not the only one. I mean, that's a very common phenomenon that you can do a single leg deadlift, for example, with almost, 2/3, 3/4 of the weight you do for both legs. What the hell's going on? What am I using my other leg for at all?
Exactly.
But also, again, just not just going for the numbers, but going for the numbers safely. And like you said before, every now and then kind of push yourself past that level of familiarity.
Exactly.
That does. I've got to be honest, I'm a little dubious about some of the hormonal stuff, or more accurately, is that what I've seen is that it wears off pretty quickly. So it's not like a systemic thing where you're increasing your free testosterone, but it does have an impact during your workout, undeniably, and helps you in certain ways. But there are some people who are selling the idea that, hey, you want to get more testosterone, just squat. It's like, nah.
Yeah, that's true. Yeah. And you have so much genetically too. Yeah. That you have your personal,
Yes, sadly, that one's not true, or that would be a piece of cake. And they go, well, look, look at these really guys who are huge and they've got high testosterone. Yeah, it's called because they're taking testosterone. It's a slightly different thing. You can do that too if you want. So, anything else that you can think of for sharing about, especially for older people? I was going to say athletes, but everyone's an athlete at a certain level. If you're walking, you're an athlete. You're just a walker.
Exactly.
You can do that. But just for people who are, whether they're rehabbing or just trying to improve, anything else that you want to toss in that you've discovered that would be helpful for them to know or stop knowing?
Yeah. I think what I found, especially as we get older, having yourself surrounded by people who are also like-minded really matters. That's why I think why CrossFit has gotten so big and why these running clubs are so big too. You have that supportive network. And again, when you have that support, you feel confident as someone who's getting older as well. Having training partners, really important as well too.
Huge.
Yeah. As you and I know, like there are days where it's like, I don't know if I want to do that distance, but just by having somebody with you, you can really get to that, where you want to hit those marks. So, and I would say, as with everything, just make sure that, you don't ignore the signs of injury or pain. It's easy to do that as an athlete who's active, especially as we get older.
Yeah.
But making sure that you are being mindful of, like, listen, maybe this isn't the day where I'm going to, run at max today. Maybe this isn't the day that I'm going to try to PR on that 5K because I'm feeling a little off. But being mindful and aware of those things will really kind of help you to maintain longevity in your activity.
You remind me of another point, which is, there's days where you feel like crap and then you put it to the test and you're actually doing fine. Yeah. And there's days that you feel good and you put it to the test and you really need to take today off. And there's, those days that are sort of where it all lines up and you feel pretty good and you put it to the test. It's like, wow, I can really increase. But of course, the joke is you have to remember that that's not your new baseline.
Exactly. Yeah, that's very true.
You might have bumped it up a little, but just the fact that day you crushed it doesn't mean the next day you're going to crush it.
Exactly. So we got to be careful of that as well. Like, maybe that success isn't what you want to base your next.
Keep that in your back pocket. But
exactly.
Back off a little bit. And
exactly. Backing off a little. And I think that's where it comes down to, Steve. It's like, we need to understand, need someone to tell us or help us to say, oh, you made that. Let's not use that as the gauge. Let's back off a little bit. Well,
since I brought up Usain Bolt a few times, he ran 9:58 in Berlin, never ran anything like it afterwards. That wasn't his, new baseline. That didn't become, the world record didn't become the next thing for him to break.
Yeah. Exactly.
So, I mean, that was just, the stars lined up and there it was. By the way, I was at the 70-meter mark, like 5 rows off the track when he did that in Berlin, just totally coincidentally. And I have to tell you, when you watch someone who run by you at almost 30 miles an hour, fast enough to get a ticket in my neighborhood, your brain just goes like this. It goes, what? It just doesn't seem real.
That's amazing. It's so exciting to see that too.
It was really fun. I've since gotten to train with some people who are, who've gotten second place to him a number of times, who are almost as fast. And same thing in real life. Like when you watch it on TV, it's like, okay, whatever. In real life, it just doesn't even look physically possible. It's like, I don't think your feet hit the ground. How the hell just happened? It's really wild. Anyway, anything else that you can think of before I dive into the simple thing of, where people can track you down? Anything else that's left in your brain?
I would say that in general, just making sure that if you're going to work with a physio in the future, if you need somebody, just making sure that you are aligned with what you need to get out of it. So what I mean by that is, if you're a runner or if you're somebody who's very active in a particular area, making sure that your physio has actually worked with people in that realm, because it's like, if they're not active themselves and you're going in as a runner or as a lifter, if they don't have any background on that, they're not going to be able to get you to where you want to be. So it's really important for patients and clients to investigate who they're working with first.
And I would add or argue that there are people who they can't do but can coach, and there are people who can do but can't coach. And so, finding someone who can coach well, first and foremost, finding someone who can do well comes in handy. Also, just because they've been through it personally, it's a slightly different thing to have that relationship. But I've also found that a lot of people who can do it, who then become coaches, they often still have some baggage from the way they learn things. They give cues that aren't really effective for someone else, but that's the one that they learned. But to your point, I mean, I guess I would phrase that. I'm going to take what you said and reframe it as, feel free to shop around.
Yes, exactly. And what also, Steve, is like, there are a lot of places out there where you go in and it's like, maybe you'll spend 5 minutes with the therapist and then the rest of the hour you're on your own.
Right.
And you're in that kind of place, that's not the place for you. You're not going to get the best care because you're not able to have somebody who's attending to you specifically for your individual needs.
That's a great thing. And, the other thing is I would also suggest to people to to do something that they rarely do with physical therapists or physios is be honest about what you're actually going to do on your own, which is typically nothing. Most people, like, they do it, they get homework from the physical therapist and they nod their head and they never do it. And if that's where you are, so be it. That's cool. Just tell someone that, because that way they'll work with that. Someone else, have you seen the show Ted Lasso?
I have not seen the show. No.
I think it's on Netflix, or it's on Apple TV. Oh my God, it's so good. But that's a bit of a tangent from, he had this one line, I wish I could remember, where he jokes about, having to go home and pretend he's going to floss. And so like, my thing is, I always set my dental cleanings roughly 2 months after my birthday, because then I use my birthday as a reminder. I better start flossing before I go to the dentist. So, because I don't do it every day, but those times where I'm reminded to, and it kind of forces me to. So same thing, know thyself. If you're not going to do it when you're on your own, let somebody know and they'll work with you on that.
Yeah, I've also told patients, over the years, I've reduced my homework for clients. I say, listen, just do these one or two things. That's all I'm asking you to do. It'll take about 10 minutes, but you're just trying to figure out what's going to have the most effect in the least amount of time for that person.
That's a great idea. And so even if for therapists who are going to give you an encyclopedia of homework, just ask them, pick the one thing that if I did that one thing, it would make you happy.
Exactly.
And I think that's a brilliant idea. Cool. So if people would like to get in touch with you and find out more about what you're up to, how would they do that?
They can email us at info@gonextlevelphysio.com, or they can actually find us on Facebook or Instagram. Our handle's Next Level Physio. My email is jerry@gonextlevelphysio.com, so they can reach me there as well.
Awesome. Well, Jerry, it's been, again, a total pleasure. I hope people do avail you of getting in touch to find out more about how you can be helpful for them near and far away. And for anybody else, thanks for being part of this. Again, go to www.jointhemovementmovement.com to get previous episodes, to subscribe, to find out about upcoming episodes, to see all the places you can interact with us on all the social media channels, etc. And if you have any questions or comments or someone you think should be on the Movement podcast, drop me an email. I'm at move@jointhemovementmovement.com. Of course, check out Zero Shoes. I'm crazily not wearing a Zero Shoes t-shirt right now, simply because my wife and I just moved into a new house that's being renovated, and I didn't bring enough laundry or enough clean stuff, and we don't have a laundry room set up. So, but go to zeroshoes.com if you want to check out our shoes. And most importantly, whatever you're doing, go out, have fun, and live life feet first.
Thank you very much, Steve.